And that will include reviewing health history for anybody involved, whether that's individuals that are single or in same-sex relationships, or in opposite-sex relationships that have been trying to conceive for some time, or if you're trying to face any type of fertility concerns or fertility preservation. That history includes personal history, that includes medical history, surgical history, family history, and reproductive history. And really importantly, we're going to talk about your goals. How many children do you want to have? What does your goal family look like? What does your timeline look like? And really my role is to help you figure out how to achieve that goal family. So treatment with goal of one child in a shorter timeline may be very different than recommendations for someone with a larger family goal over a more protracted timeline. The basic testing includes testing for all parts and pieces that are included for human reproduction. That type of testing for individuals with ovaries will give us a relative assessment of egg supply. So it's either high, medium, or low. It doesn't tell us exactly how many eggs you have left, and that is an important question because as individuals with eggs, we're born with every egg we'll ever have, and our quality and quantity go down over time, but everybody's rate is a little bit different. Some people go much faster and some people are much slower, and things start to change much more quickly in our late 30s and early 40s. We also want to assess the anatomy. That includes the uterus, the fallopian tubes, and interestingly, most people think that sperm and egg meet together in the uterus. They actually meet in the far end of the fallopian tube and then have to travel down the fallopian tube over about the next week, then find a nice healthy spot to stick in the uterus and grow. That brings us to the last component, which is sperm. And we want to make sure that not only we have sperm, and interestingly, people can have an erection, they can orgasm and release fluid with the ejaculate, but not have sperm in that and not know unless I put it underneath of a microscope. And that allows us to look not only at how many million sperm we have per milliliter, but how are they swimming? Are they what I call either the Olympic athlete swimmers swimming in a really nice straight line trying to get out to that far into the fallopian tube where the egg is, or the little ones hanging out in the kiddie pool with the water wings just struggling to move around, the twitchers or the spinners per se. And that's really important because they do have a very long swim to that far end of the fallopian tube. Some couples feel like, hey, you know what? We tested everything. It looks great. I'm just going to keep trying. But that is actually what we would call unexplained infertility. If I do all of the tests, we find that we have eggs, we're ovulating eggs, releasing an egg each month. We have a passageway for sperm and egg to meet through the uterus and fallopian tubes, and sperm number and quality looks appropriate, then that means that you would have a unexplained infertility diagnosis, which is up to 20 to 25% of couples.